I think this next segment deals with something very important. It's for survivors of violence in West Michigan, and they now have a new lifeline. Corewell Health has opened the region's first trauma recovery center, offering free comprehensive mental health care to help victims of violent crimes, help them to heal and rebuild their lives. And here to tell us more about this is Dr. Subodh Jain, who is the Vice President and Department Chief for Behavioral Health. This is an amazing program, just in the reading about it. I can't quantify this, but as we read the news every day, we hear about violence on a daily basis and people who are victimized. How did you come to the decision to open this in light of the fact that the need would appear to be great?
Unfortunately, violence in our communities is prevalent, it's pervasive, and it's happening each day in front of us. The other challenge is these victims are coming from vulnerable and indigent population who do not have the resources to actually get to the right care once any trauma is inflicted on them. This trauma can be either rape or sexual assault, intimate partner violence, domestic violence, families of homicide victims. All those that trauma is either unaddressed or under-addressed. So these folks actually come to us in different ways. They are either in our primary care offices, they are in our emergency rooms after the trauma, they can be in our addiction clinics because substance use is a huge component of that follows the traumatic events, and we are obligated to treat them for not just the medical care, but also as a whole person care, including their mental and psychological health. So keeping that commitment to the community of providing the whole person care, Corewell Health decided that we need to invest in this this care model where comprehensive mental health care is provided for the trauma victims. And we fortunately received a grant from the state of Michigan that just launched this clinic.
It's really amazing as you explain it, because it's about treatment of all of the symptoms that go along with this violence, and obviously there's a lot of trauma that is not physical that goes along with that. What kind of services will people be able to access at this facility?
Yes. So ours is a comprehensive mental health clinic. So first will be psychiatry. That means anybody who has been exposed to trauma in their acute situations can get medications for anxiety, depression, PTSD. Second will be psychological services. If there is any additional testing or psychological support is needed, then we'll have a psychologist. We also have 3 trauma-trained psychotherapists who will be part of providing this care to all the victims that walk through our doors. On top of that, the care doesn't stop only with a direct care. It's also more than that. It's the care coordination. It's transition of care from one medical service to the other. It's also finding them the support in the community. For example, many of these victims could also struggle with housing. They could also struggle with transportation. So we will have services that could actually connect to the community agencies which are doing this wonderful work, but in fragments in their own ways. So when the victims of trauma walk into our clinics, we will have social worker and case management who can help with that too.
We're going to run out of time. This is fascinating. I'd like to spend another 20 minutes on it, but right now, if there's somebody out there that falls into this category, how do they access these services?
First, we'll have walk-in services. Our clinic is located at 75 Sheldon, right here in downtown. And then it can be referral through your primary care physicians. A lot of our patients are in our addiction clinic treatments. It's the same location. They're co-located there. We have a downtown multidisciplinary trauma clinic, which is ortho trauma, neurotrauma, the medical trauma. After that, we are getting a lot of referrals from that. And then you can call Corewell Health.
Doctor, thank you so much for taking time to explain it. Good luck on this new adventure that is going to be helpful for the community, and thanks again for being here.
Thank you very much. Thanks for having me.
You bet.